When you arrive on the day of your colonoscopy, make your way through the main doors of the Polson Tower. Go straight to registration. At registration, they're going to give you some documents that you're going to bring to ambulatory care. You're going to go walk past the coffee shop and bring those documents to our main clerk. She's going to verify your ID, check your name, your date of birth, and what kind of scope you're getting done. After that, she's going to direct you to go sit into the blue chairs. Once in the blue chairs, another staff member will come and explain to you on what you need to do to get changed for your procedure. You're going to get a colonoscopy, you need to take everything off, apart from your socks. You're going to put a blue gown opening to the back, cover your back with the brown house coat, put the blue slippers on your feet, put all of your personal belongings in a pillowcase, and bring it with you and go and sit down in the blue chairs. A nurse will come and get you in the blue chairs and walk you over to a different admission area where they're going to review the paperwork with you. They're going to ask you about when was the last time you had something to eat or drink, the type of prep that you've taken, if you've taken any medication for your diabetes, if you've taken any blood thinners or any painkillers. We're also going to review the whole list of your medication that you take on a regular basis. I'll also check to see if you have any allergies to medication. Once that's done, we'll also check your vital sign and we're going to insert an IV in your arm. If you're a diabetic, we will be verifying your blood sugar levels. We will also confirm that you have somebody that's going to be watching over you for the next 24 hours at home. When it's your turn to get your procedure, the nurse will come and get you and confirm your name, your date of birth, and the procedure that you're getting done. She will then walk you over to the procedure room. We will remove your house coat and have you sit down on a stretcher. We're going to verify your vital signs, give you some oxygen through your nose, and connect the IV to some normal saline. Once that's done, we'll ask you to lie down on your left side. After that, the doctor will come in and explain to you the procedure. At that time, if you have any questions, that would be the time to ask the physician. So when the team is ready, the doctor will start by doing a rectal exam. The nurse will be giving you some sedation for the procedure. There's two types of medication she will be giving you. The first one is a medication to help you relax. The second one is a medication to control the pain. During the procedure, you will feel a little bit of bloating and cramping, and that's normal. It's very important to keep breathing. Don't hold your breath because that'll kind of make it all tight in your abdomen. The nurse will coach you through this, and if you require any more medication for the procedure, we can always give you more. The physician will then introduce the scope through your rectum and make their way through your large intestine all the way to the end where there's a little valve that connects to your small intestine and also where the opening of your appendix is. Once we reach the end, this is when we start slowly pulling out, and that's where we have a really good look at your colon. If we see anything concerning, we can take pictures, we can take samples. If we see polyps, those are skin tags that grow inside your colon, we can take them out as we go. If we do any of these things, we will write it down on a piece of paper for you, and we will explain in more details what we did during the procedure in the recovery area. During your colonoscopy, if we remove any polyps or take biopsies, you might notice a little bit of blood in your stool for the first or second bowel movement. That should clear out after that. If you pass blood clots or you pass more than a third cup of blood, those are concerning signs. Please go to the nearest emergency department to get evaluated. After the procedure is done, we will wheel you over to recovery. That's where the nurses will be monitoring your vital signs and monitoring your comfort. You will be staying with us in recovery for about 30 minutes. We will be calling your ride and letting them know when they can come and pick you up. That is also where, once you're awake, we're going to give you some instructions on what we did during the procedure and what needs to be done for any type of follow-up. Especially if we've taken any samples, biopsies or polyps, those takes about 4 weeks to get the results back. So you need to call the office to whether make a telephone appointment or an office appointment with the performing physician. Or sometimes we will write down to follow up with your family doctor depending on the results of your colonoscopy. Once the nurse is done explaining to you what we did during the procedure, we will remind you that you are legally impaired for the next 24 hours. This means no driving, no signing legal documents, and no use of alcohol or recreational drugs for the next 24 hours. Everything that we're explaining to you will be written down on a piece of paper, especially when you need to restart your blood thinners or resume any medication that you take. The follow-up is going to be written down on this paper that we're going to give you. Once we're done explaining all this to you, we'll offer you some juice and cookies. Once you're done your snack, we'll ask you to get dressed. Please, when you get dressed, try to get dressed in a sitting position as much as you can. You will feel a little bit wobbly, a little bit dizzy because of the sedation we gave you. Once your ride arrives, we'll accompany you outside the department so you can kind of meet your person that's picking you up. Just take the rest of the day easy, no big projects, go ahead, get some good food, and rest. Now that you've watched this video and feel prepared for your colonoscopy, once you're in our department, at any point you can ask nurses any questions. If you have some clarification or questions that you feel that the video did not answer, please do not hesitate to ask.